everyone. Welcome to another episode of the Anti-Pharmacist podcast. How was your weekend? I want to welcome you to a very brand new week, and I hope you are feeling Christmas in the air already, because I am. Yes. So today, on today's episode of the podcast, I want to discuss a topic with us that most people may not pay attention to. I don't know for what reason, but maybe I'm also paying attention to it because I'm a healthcare provider. Alright, but the truth is, everybody uses medication in their house at one point or the other, right? And I'm sure that there are some medications that that have been in your house for years. Literally, no exaggeration. You may just be sweeping or rearranging maybe your medicine cabinet or something, and you just see some old medicines that have been there. Most of them are even expired, and you just keep them there. Like, for what? Why? What is the why? Which is why I'm making this episode, because there are ways to dispose of these things. That's what I'll be discussing today. Proper disposal of medicines. A lot of people are not paying attention to it, I know, and that is why I'm bringing it to your notice today, so that you know what to do with those old medicines that you keep in your houses. So let me just get right into it. First, why do we need to properly dispose of our medicine? Okay, emphasis on properly, because I know that there might be people that will say, of course I dispose of medicine all the time. I don't even like leaving medicine in my house because of my children. I just throw them in the trash. No, that is not proper medicine disposal. So why do we need to dispose of medicines properly? Number one, to prevent accidental poisoning, especially in children. When you leave your drugs anyhow, either expired or not, children can just go near them and take them. Do you understand? You keep one syrup in the fridge like that, they see it when they open the fridge thinking it's one sweet thing, and they just down it. So that is one reason. Another is to prevent drug misuse. Drug misuse in the sense that maybe you bought 2 sachets of a particular medicine, but you needed only 1.5. The remaining half is there for one particular condition that you saw your healthcare provider for a long time ago. Now you are feeling some kind of way. You just decide that, this was the way I felt when this drug was given to me. Let me take it. It encourages self-medication, which leads to drug misuse. What if what is wrong with you this time shares the similar symptoms with what was wrong with you then? And this is not the right medication, but you have used it based on your own assumption because the medicine was, around you, because it was easily accessible. That is drug misuse. Then drug abuse. There are some drugs that are abuse dependent, that you feel the compulsion to take after taking some of them. You understand? So if you have these kinds of drugs around, like sleep medicines, for example, hypnotics, you might be tempted to keep using them, because they are available, easily accessible. But if you have to go through the stress of going to see a doctor, to get a prescription, to go get it filled at the pharmacy, you may be discouraged from abusing these medications. Alright? Those are the 3 major reasons why you should dispose of your medicine properly. But then, another reason, which may not be directly related to people in the household, is for environmental safety. Okay? If you just throw your medicine around, for those that believe that throwing it in the trash is enough, it may pollute the environment. It might be ingested by animals, and these animals in turn, you eat them later, or they pass excreta into the surroundings, which you inhale through air, or they are washed into water bodies during rainy season. At the end of the day, it still comes back to you. So those are the 4 major reasons why you should dispose of your medicines properly. Now, what are the ways to dispose of medicines properly, you would ask me? Well, I will tell you. Number 1, I talked about trash, right? Yes, you can throw it in the trash, but there is a way to do it. Okay? Throwing in the trash is the most convenient way, but then you must do it based on a particular protocol, so that you don't cause harm to the environment and you do not encourage drug abuse. The first step is take the medication out of their packets. Okay, maybe the medicine is in one drug pack. Take it out of it. If it's in a blister, a sachet, take it out. Then, if it's in a capsule, you don't have to remove the capsule. I hope you understand. Then mix with an undesirable product. It could be cement, it could be spoiled food, it could be pet food, maybe cat litter or dog food. mixed together with it, such that that drug is already mixed with it. It cannot be separated anymore. Then you pour it in a sealable container. Sealable container. It's not just a container that will be open to the air. No. Sealable container, maybe old plastic that has a lid here, or a Ziploc material. Sealable container. Then you can throw it in your trash. That is how to go about it. Alright. Now, for those that might be wondering that if I see it in the film all the time, I can just flush it down the toilet. No, not all drugs should be flushed down the toilet. There is an FDA list called the flush list. It contains medications that can be flushed down the toilet, and there are two major reasons why they can be flushed down the toilet. Number one, they are drugs of abuse. Drugs that even if you throw in the trash, even if you mix with unwanted substances, because of that addiction factor, some people might still get to it, rummage through your trash and find them out, go and clean them up and still take them because of the problem of addiction. I've talked about that on the podcast. It's a psychological thing. It's non-rational. And the second reason why you can do this is because they do not really pose much risk to the environment, because they are not washed from the sewage into water bodies. That is the second reason. Yeah. So those you can flush down the toilet. Example are opioids, your diethylcodeine, your codeine, okay, your fentanyl, your morphine. You can flush those down the toilet to prevent abuse. Okay. Another class of drugs that you can flush down the toilet are liquids, your suspensions, your syrups. You mix them with liquid, dilute them very well, then you can flush them down the toilet. And that is the second means of proper medicines disposal. The first one, trashing them, but following the due process, the due protocol. The second is flushing down the toilet, also following due protocol. And you know why? It's not all medicines that you can just flush down the toilet if you're not using them anymore. And the third and most important means of proper medicine disposal is taking them back to drug take-back locations. Yes, I know that this might sound strange to you. In other countries, there are locations for drug take-back programs, as stipulated by the FDA. Also in Nigeria, NAFDAC recognizes this, but I don't know if it's implemented yet. But I'm telling you that it exists, okay? Drug take-back locations where you can take your unused medicines, your expired drugs, just drop them there. The regulatory authorities know how to get to them and mop them up. And the reason why I'm telling you this is because you may think, this is not easily accessible. How do I locate a drug take-back location? At least I'm in Nigeria. I don't know anything about that. Your local pharmacy is actually a drug take-back location. Imagine that. You didn't know, right? Well, you heard it first on the Anti-Pharmacist podcast. Your local pharmacy is a drug take-back location. So all those unused drugs in your environment, if you feel like it's a hassle, it's a bother for you to start mixing it, to start trashing, you don't know which one you should flush, just pack them up and take them back to your pharmacy. When you get to the pharmacy, just present them to your pharmacist and say, Anti-Pharmacist said that this is a drug take-back location. Take this, okay? Tell them that Anti-Pharmacist said so. And whatever they say, you just come and tell me. So your local pharmacies are drug take-back locations. These places are safe for your unused or expired medicines, because these ones, they know how to store these medicines in a way such that the regulatory authorities like NAFDAC will come back and mop them up and dispose of them properly. You see, WHO has a guideline, a protocol of disposal of every type of medicine, every drug class, every drug dosage form, okay? I will be running through that for you so that you can know that these medicines, they're actually proper ways of disposing of them without harming the environment, okay? So take them back to your local pharmacy and say, I'm not using this medication anymore. I've changed from this medication. This has expired in my house. I don't know how to dispose of it properly so that I don't harm the environment. The pharmacist, take. And the pharmacist said I can bring it here. I'm sure that no pharmacist will turn you back. I'll take your medication back. No, it's part of our duty to the environment, to the society, to keep everyone safe, okay? Now, let me run through the list of the pharmaceutical categories and the disposal methods according to WHO. For solids, you can dispose of them by landfill. For semi-solids, waste encapsulation. And for powders, waste innertization. Landfill meaning that there are particular places that are dedicated to this purpose where drugs can be buried without any harm to the environment. They're actually in places that are not accessible to people, so nobody can go there and start rummaging through. There are places that are not prone to any environmental hazards that will not cause any problem to the populace. Okay, for semi-solid waste encapsulation, they find a way of mixing them with things. They can mix them with cement. Do you understand? They can wrap them in things in which they will not be able to escape to the environment. And for powders, waste innertization, they mix them with chemicals that will inactivate them such that it will turn them to non-harmful substances. Okay. For liquids, sewers, like I said, your liquid dosage forms like your syrups, your suspensions, your solutions, you can mix them with water and wash them down the toilet. Of course, high temperature incineration is also done for some liquids. Okay. Then for ampoules, those are the things that are used to pack your injections, that contain your injections, those glass materials that you have to cut. They are to be crushed and flushed after dilution with fluid into the sewers. Okay. Then for anti-infective drugs, the likes of your antibiotics, antifungals, antivirals, anti-malarials, they're anti-infectives. Leaving them lying in the environment can cause antimicrobial resistance, right? Like I've said. So the proper disposal method is waste encapsulation, waste innertization, and medium and high temperature incineration. All these are carried out by the regulatory authorities. Okay, this is the end of these expired medications. This is what is done to them to get rid of them. Okay, yours is just to take them to the right places. In other countries where the waste disposal is well carried out, waste are shared into categories, and these categories are taken to the right places. You have a place for recycling, the likes of your drug packets, your papers, put them in recyclable bins. Others maybe biohazard waste, that's where your drugs will be. They will be in another place. Wet waste will be in another place. Each waste is taken to the right places. So this is the end of those biohazard waste, of those drug waste. But since some countries like Nigeria do not have that, at least as far as I know, take this to your local pharmacy. Your local pharmacy will revert them to the right authority and they will do the right thing. Okay. For your anti-new plastics, you can't just dispose of them anyhow because they pose risk to the environment. The thing they do with them is that they return to the donor or the manufacturer does know how to actually destroy them. Also, waste encapsulation, waste innertization is done. Medium and high temperature incineration is also done. Then for controlled drugs, waste encapsulation, innertization, medium and high temperature as well. Okay. For aerosol canisters, the likes of that, your inhaler, your discos, your insecticide canisters, those are inflammable. They can explode if you try to burn them outside. So they use landfill and waste encapsulation to properly dispose of them. Then for disinfectants, liquid forms or whichever form they come, use them. If you have them in your houses, just use them. No matter how many years they have been in the house, use them to clean surfaces. Just make sure that they do not pour your skin or your eyes or you do not ingest them. Okay. Or you could mix them with liquid, dilute them very well and pour them in sewers, flush them down the toilet or fast flowing water course. They should not cause much harm after proper dilution. Okay. Then for your PVC plastic and glass, landfill is the way in which they are disposed of. Okay, when I say PVC plastic, those blisters of your drug where you take the drug from, those are PVC plastics. It's landfill because some of them are non-biodegradable, or even most of them. Then for paper, cardboard, like I said, they recycle them, they burn them, or they also put them in landfills. I have told you that these landfills are dedicated areas, usually outside the outskirts of the city, in abandoned areas where nobody goes to except personnel that are authorized to go there. So these are the proper ways to dispose of all of these medicines. I've told you, number one, if you want to trash it, the right procedure I've mentioned. Number two, if you want to flush, there are some drugs that you can't flush and there are others that you can flush. I've mentioned them and the reason why you can't flush them. And the third is taken to your local pharmacy as drug take back centers. Okay, Those are the ways to properly dispose of your medicine without constituting any nuisance, without constituting any problem to the environment. The approach now to health is One Health. That is the name given to it. And this is ensuring the health of not just the human, but of the environment and of animals. Because at the end of the day, it's a cycle. We live in the environment, we interact in the animals one way or the other. Some we have as pets, some we eat as food. If you only take care of yourself and look out for yourself without looking out for the environment, at the end of the day, everything comes back to you. Of course, we breathe in air. What you release to the environment, you take in eventually. It still affects your health, right? Even if you're taking care of yourself, even if you're doing your normal checkups. If you leave things in the environment anyhow, maybe medicines, you trash them anyhow, animals can ingest them, then pass them out as excreta, or they get washed into water bodies. When you eat these animals, now that festive seasons are coming, you kill your chicken, you kill your goats and cows. At the end of the day, you take them back in. I've talked about how this affects antimicrobial resistance too. So all of this together still affects you as a person. So you must be cognizant of the whole environment, your ecosystem, both the animals there, the plant, the atmosphere, then yourself. That is the aim of One Health. And this was a major focus of the RSTMH conference, which I attended in July. I know that I said that I will bring it to this podcast, and I'm working on it. It's a lot of information, and I'm trying to compress them as much as possible so that I don't take too much time explaining them. Watch out for that episode. It will be coming on this podcast very soon. Thank you so much for listening up to this point. As always, I am grateful for your support, but I still need you to continue to support me. Share this podcast, okay? Comment, subscribe, like the posts, and click on the links. Don't just like the post. I see your likes all the time on Facebook, on LinkedIn, but most importantly, click the links, listen to the end, comment, share, follow, subscribe, to all of that for your girl. I appreciate it, and I need your support to take this podcast to the next level. Thank you so much. You can follow me on IG at Antipharmacist Podcast, on Facebook and LinkedIn at Bimisola Dipsy. Just say on X at Farm Podcaster, and you can message me via mail for collaborations. If you're creative, if you're a podcaster, you're interested in health, pharmacy practice in Nigeria, just message me, via DM on all the social media platforms, or via my mail at antipharmacistpodcast@gmail.com. Let's collaborate. You can invite me to your show. I can invite you to mine. Let's just do something together. Let's make impact on our community, on our environment. I hope that you enjoy the rest of your week. Till next time, stay healthy and God bless you.